Hello, everyone. My name is Helle Jacobsen, and I work for Amnesty International here in Denmark. And I'm the program manager for our work on gender, women, and LGBTI rights. I've been working within the field of international human rights for the last 10 years, and with a specific focus on LGBTI rights for the last 8 years. I've been the lead on Amnesty's research. I was happy to see that Pedersen was mentioning our report, so I just wanted to show you. This is our report from 2016, focusing on transgender people's access to health in Denmark. I've also been doing research on our report from 2014, focusing on the access to legal gender recognition for trans people in 7 European countries, including Denmark. Thank you so much for getting the opportunity to speak today, and I'm so happy to see so many people attending, because this is indeed a very important topic. And of course, the reason why Amnesty is working on this is because it's about basic and fundamental human rights. Amnesty was very pleased to see the decision of the Danish Parliament to remove the psychiatric diagnosis. And we think it's crucial that this will also lead to a paradigm shift in the access to health for Danish trans people. Whether at school or in the workplace, or anywhere else in society, transgender people are often discriminated against because of widespread prejudice and gender-based stereotypes, stemming from standardized notions of masculinity and femininity. Transgender people are therefore a vulnerable minority group, and this places a special responsibility on governments and health authorities in the protection of transgender people's rights. Amnesty's work always focuses on international human rights law and conventions. And international protected human rights are applicable to gender identity as acknowledged by the Yogyakarta Principles, which crystallizes the current status of human rights law in relation to gender identity and sexual orientation. Let me quote from the first principle. All human beings are born free and equal in dignity and in rights. Human beings of all sexual orientations and gender identities are entitled to the full enjoyment of their human rights. And central to the respect for human rights of trans people is the recognition of gender identity as a ground of discrimination. In Denmark, despite the removal of the psychiatric diagnosis, trans people still go through mandatory psychiatric screenings in order to access hormones and surgery. In fact, the reality of the psychiatric screenings of all trans people only of the basis of their gender identity is very problematic, because it is that medical professionals are making decisions on identity features that are actually personal to the individual person and do not manifest themselves in a uniform and consolidated pattern. What we have seen in all 3 publications we have published on trans people in Denmark is that it's not voluntarily that trans people go through these psychiatric screenings, for example, in order to access hormones. In total, we have interviewed more than 50 trans people. Trans people who spoke to Amnesty International felt that the screenings were based on gender stereotypes, and they felt that it took the decision-making power about their own gender identity away from them. Charlie, a transgender man living in Denmark, said, "You have to try to convince the mental health professionals that your transgender identity is not a whim. They kept asking whether I was sure that I was not just a lesbian, and whether I had tried to do this or do that to live as a woman. They were interested in what I liked in bed. They asked me how often I masturbated, if I wanted to be the dominant partner in bed. You constantly feel you have to give the right answer, but you don't know what it is. You feel you're under examination. When I said that I was sexually dominant, he, the mental health official, said, well, then I could be a man, because that was a typical masculine behavior. His approach was very black and white. Another question trans people told us they were routinely asked was, what did you prefer playing with by the age of 4 to 6, boys' toys or girls' toys? The United Nations Convention on the Elimination of All Forms of Discrimination Against Women requires states to ensure that state policies and practices are not based on or have the effect of reinforcing gender stereotypes. According to Article 5A of the Convention, states should take measures to modify the social and cultural patterns of conduct of men and women with a view to achieving the elimination of prejudice and all other practices which are based on the idea of the inferiority or superiority of either the sexes or on stereotyped roles for men and women. International human rights also underlines that trans people should not be forced through psychiatric screenings just because of their gender identity. No person may be forced to undergo any form of medical or psychological treatment, procedures, testing, or be confined to a medical facility based on sexual orientation or gender identity. Notwithstanding any classifications to the contrary, a person's sexual orientation and gender identity are not, in and of themselves, medical conditions and are not to be treated, cured, or suppressed. Many of the trans people we interviewed during the last years told us that they feel like this really in-depth testing for all kind of different psychiatric diagnoses is just, looking for something else, that they couldn't be trans, there must be something else wrong. Trans people has, like everybody else, the right to define their own gender identity and make decisions around their own body. These rights are taken away from them when they are still forced through the psychiatric screenings in order to access hormones and surgeries. And what we have seen from our research is that since 2014, when the guidelines were changed, a lot of trans people have been forced into self-medication without having anywhere to go to get their hormone levels tested. We also documented that trans persons' access to health is being limited and their right to privacy violated, among other things because of questions about sex, sexual preferences, and sexual orientation. Several people reported to Amnesty International that they were asked if there were any homosexuals in their families. Before 2012, it was possible to get hormones from a gynecologist without a lengthy psychiatric screening. Amnesty has not seen any medical arguments for changing this practice that has worked well for decades. Just alone, 2 gynecologists here in Copenhagen were treating 200 trans people altogether. Trans people told Amnesty International that they felt met with respect and that they felt like their self-determination was being heard here. So Amnesty proposes to open up this possibility again. In the Danish Health Law, Chapter 5, it states that it is important to involve the patient in decision-making and for the process for the patient to be transparent. All the trans people Amnesty has interviewed told us that they did almost not get any information about the length and the purpose of the different, for example, psychiatric screening tests they had to go through. They did not feel involved and they did not see the process as transparent. So Amnesty's main recommendations to the Danish Health Authorities are no more forced psychiatric screenings on trans people as a group. If there is an indication, you can make a referral to a psychiatrist or a psychologist. And access to hormones through a gynecologist, again, as it was before. Medical practices must never violate human rights. My last point before I close my presentation is to stress the responsibility from the Danish authorities to involve trans people in the development on the new guidelines and to listen very hard to what they have to say and let that be a big and important contribution to what the new guidelines should look like. You know, the best people to make decisions about trans people are trans people. Thank you.
So, yeah, it works, it's good. As mentioned, I'm part of Transpolitisk Forum, which is a group providing a platform for transgender activism in Denmark. I'm also a psychologist, an authorized psychologist in Denmark, and I've worked a couple of years as a neuropsychologist in the Danish healthcare system, so I do have some experience from how the Danish healthcare system actually works. Last weekend, an interesting document came into our inbox, and this is the newest draft for the new guidelines for transgender individuals in Denmark. It's quite interesting to get these sent to us a week before a conference where we're actually supposed to talk about the content of new guidelines, but apparently they're already working hard on it. So my talk will focus mainly about the content of the newest guidelines and what we in Transpolitisk Forum see as problems in these guidelines. The first thing is that the Danish Health Authority, instead of pathologizing being transgender, which is what happened before, they now pathologize the term gender dysphoria. And this is of course just as problematical, as doctors now, rather than being given the role of deciding whether someone is transgender or not, they're basically being given the role to actually decide whether someone has gender dysphoria enough to be able to get access to treatment. But basically, doctors are still the ones who have the power to decide whether someone needs treatment on the basis of their gender identity. We think that this is highly problematical, and gender identity, coming from a psychological perspective, is something that should be 100% self-defined. The trans individual who is seeking help from the healthcare system is actually the only person who can define the gender identity and determine whether they need treatment or not. And this should be made 100% sure and clear in the guidelines that a doctor cannot diagnose someone's gender identity. I'm more than willing to admit that the healthcare system is built in a specific way, and it's not perfectly adjusted to cater for treating trans individuals. And I'm aware that the healthcare system normally works within a frame that requires that a doctor must assess whether there is a medical indication for treatment. Doctors are used to normally taking blood tests, scans, doing lots of different tests to check whether there is indeed an indication for diagnosis. Well, this might sound a bit simplistic, but actually here, what we need to do is maybe actually something quite different. And as gender identity is self-defined, is actually ask the trans individual, are you transgender? I know it sounds a bit extreme, but maybe it is necessary. Now, I'm not saying that the Danish healthcare system has no role in treating trans individuals. It definitely does. But we think that the rule is twofold. The first thing is that the Danish health system should provide advice regarding possible treatment options, hormone surgery and other forms of treatment to inform on the consequences and possible side effects, provide prescriptions and then follow treatment. Also, we think that trans individuals should receive free, optional psychological support before, after and during starting treatment. Living as transgender can be very tough in the society we live in, there's no doubt about it. Many do struggle with depression, anxiety as a consequence, and as I say, as a consequence of struggling to meet up to societal expectations. There are also individuals who struggle out and who struggle in figuring out their gender identity and who could benefit from support from people. But I cannot stress how important it is, and this should be made clear in these guidelines, that for this to actually be effective, for help from a psychologist to be effective, it must, one, be optional. It can never be forced onto someone, and it must be provided by someone who in no way whatsoever is involved in making decisions regarding access to treatment. Yeah. Otherwise, and we know this, any psychologist who actually works as a psychologist should know that you cannot force someone into doing therapy and it having actually a positive outcome. Therapy with a psychologist relies on a good therapeutic alliance in order to be effective and relies on the person wanting to actually have help. If the individual is pressed into therapy, it will not be effective. It's just a waste of money. The next point, which is something that Transpolitisk Forum is fighting hardly for, is that it should the treatment or contact with transgender individuals should be removed fully from psychiatry. And this should be stated far more explicitly than it is right now in the new guidelines. we all know it, being transgender in Denmark is no longer considered a mental health disorder. We do not think there is any reason why trans individuals should, as a standard, be forced through psychiatric evaluation in order to access treatment. And here, we mean three things by this. We mean, one, the content of this evaluation should not be psychiatric. Transgender persons should not, as a general rule, have to fill out screening tools for mental health disorders or personality disorders, nor should they have their IQ tested in order to get access to treatment. And this is actually the case as it is now. Another thing that it states is that mental health disorders should be stabilized before you can have access to treatment. There are surely many mental health disorders that do not need to be stabilized before you can get treatment and that are fully irrelevant. And this should also be specified. The next thing is place, physically, where trans individuals actually meet the healthcare system. It should not be a clinic that is psychiatric in nature. Sexological Clinic in Copenhagen, we know, is part of the psychiatric system. And the Health Authority states in the new draft, which is something that actually sounds good for a change, that treatment should be carried out in a way that stigmatizes the least possible. Not bad. We highly support this, but according to us, treating transgender people at Sexological Clinic that normally treats, or also treats, sex offenders and people with sexual dysfunctions highly contributes to stigmatization of trans individuals. Mm-hmm. And it also actually encourages society as abroad to actually see transgender issues to be something directly related to sex or sexual dysfunction, which is not the case. We know it's got to do with gender identity. The last thing out of these three things is that the primary caregiver, primary doctor in charge of the whole process should by no means be a psychiatrist, but a doctor who's actually specialized in the treatment that's needed, which is therapy, hormones or surgical treatment or other types of treatment which are actually related to the body, not to the mind. Surely it would make more sense for the person in charge of treatment to actually be specialized in the treatments that are actually being offered. This should also be made more clear in the guidelines. We don't see any reason why a psychiatrist should be a fixed part of any kind of team who should be meeting transgender individuals. This is not something that we normally do in the somatic system. If you actually do have a specific, see specific symptoms that could indicate that someone does have a psychiatric disorder, you refer them to the psychiatric system. The same should be the case for transgender individuals. Treating transgender individuals separately in this situation is basically directly discriminatory. One of the main counter-arguments that I've heard to justify that trans individuals should be mentally assessed prior to treatment is, one, the treatments that people get is irreversible. Two, that it can have severe side effects. This has been repeated and mentioned again and again by spokespersons from Sexological Clinic and by the Health Minister herself. Here, it's worth just mentioning that most forms of medical interventions, pharmacological or surgical, in the whole healthcare system are actually irreversible in nature and also have side effects. And although these interventions are irreversible, patients are not forced to undergo psychiatric evaluation. But I'd be quite intrigued to know whether the Danish Health Authority is planning to actually introduce this for all somatic patients, to actually check whether they have psychiatric disorders before they can say yes to any form of surgery. This might be the case. It'd be interesting to hear what CERN is planning to do. So yeah, screening for psychiatric disorders should, just like in the somatic system, be carried out only if there are specific symptoms present that could indicate a possible issue that would directly impede an individual's ability to make decisions. But this should not be carried out systematically. In most areas of the healthcare system, when we meet patients that are adults, we don't expect them to have psychiatric disorders, and we don't generally expect that they can't make their own decisions about their body and about their lives. With transgender individuals, it seems this has been basically put on its head, and we meet individuals in the healthcare system and actually just start by thinking there must be something wrong with them and they have to prove the opposite. Let's meet transgender individuals with the same approach that we do all other individuals in the healthcare system. I'll start concluding, maybe. Would that be good? Of course, this draft is actually quite disappointing. When we, in Transpolitical Forum, have been fighting for years to improve the way transgender individuals are treated in Denmark, it's just as pathologizing. They've just changed the words. Minor changes have been made, That is also positive, of course. But as people have mentioned earlier today, why not actually take this opportunity to make real changes for trans individuals? It's not rocket science, seriously. It really is not rocket science. Ask the individual, what do you feel like? What do you need? And then try and cater for it. We need to reinvent the way trans people are met in the medical system.
As stated earlier, for 3 decades, transgender people went to their own doctor and got a referral to a specialist and started hormone replacement treatment. A practice that has been in place without known problems. In 2012, the Health Authority emphasized that hormone replacement treatment should be considered a highly specialized treatment. That led to the system we know now, with a strong psychiatric evaluation before permission for hormones. This has caused a lot of problems. So we now have a situation where a hypothetical problem was addressed and created some serious, real problems. Self-medication is exploded in the transgender community. We have known cases of unfortunate transgender people getting drugs from India or Asia that was contaminated and made them sick. So, from a healthcare view, the system has made everything worse. The purpose of the evaluation, the psychiatric evaluation, is to save someone from regretting the treatment. At the same time, a far larger number of people who could actually benefit from the treatment are denied access to the treatment because the method to screen people are too strict. So it's plain stupid.
Yeah.
Then we have the multidisciplinary team. Even so, when you contact at a clinic, you have to fill in a consent form stating who can access information about your treatment. By creating a multidisciplinary team, 3 different clinics will have access to your information and can share it without your permission. That's a violation of our rights to privacy. Then there is the term real-life experience. What's that? How do you measure it? You can't measure it. You can't test it. Why then state it in the guidelines? Should the real-life test be binary, non-binary? Who can define it? It's meaningless. That the treatment is highly specialized doesn't mean that it's highly qualified care. We want high qualified care instead of high specialized care. Then there's in the new draft. In the new draft, the specific mentions that that any surgery on genitals requires castration first. Not even though it's not always necessary. That's forced sterilization. Let's take the method that some trans men use or prefer, enlargement of the clitoris. There's no need to sterilize them, except for preventing them from having babies. That's okay.
Can I add something now? Yeah, that'd be you, please. Another thing that I would like to stress, which is also just following up about what we talked about this morning, is actually the process itself in making these new guidelines. I know that, I can't remember who it was mentioned, that they want to, well, in the sexological clinics, actually continue involving users in the process of developing new guidelines. What I want is them to actually start doing that, because as far as I can see, the extent to which actually users have been involved has been actually pretty poor, even in most other areas of healthcare, I mean, basically any other area of healthcare, users actually being involved more than we are, and I think that that's highly problematical. So maybe we should take this actually as a starting point today and actually hopefully be involved a bit more regularly in the process. I think that would be in its place. Maybe ask the people involved what they actually think.
Okay.
I would like to add one more. One of the earlier speakers mentioned that transgender people are exposed to stress and stigmatization. I have been exposed to stress and stigmatization in the healthcare system.
Tak, så I brugte næsten ikke hele jeres tid, så har vi lidt mere tid til at diskutere, hvis Astrid og Birte vil komme op på scenen. Og så muligvis var det, der var i vejen med mikrofonerne, var rundhyldt, fordi folk stod for tæt, så nu stiller jeg mig herover i stedet for. Og se om jeg kan styre det herfra, uden at der kommer for meget